morning to one and all, ladies and gentlemen. Mr. Lauren Bellon, Senior Vice President Operations. Shri Venkatesh Srinath, President, Danaher Global India. Veronique, Vice President Marketing. Ravi Kumarji, Vice President Danaher. Srimati Sumati Randio, and all my esteemed guests who are part of this great initiative, friends from media, Namaskar. First of all, I would like to congratulate and thank Cepheid for choosing Karnataka and in particular Bangalore rural to set up its first manufacturing site in southern Asia. I am told that nearly 41% of the workforce in this unit are going to be women. So, I appreciate Cepheid for being an equal opportunity employer and empowering our women. Recently, we have celebrated the World's Women Day on the March 8th. Even our state government, we are very committed to empower our women. Our great saint and philosopher Swami Vivekananda once said, if a bird has to fly, we all know that both the wings is very important for any birds to fly. Similarly, if any society has to be successful, there should be equal opportunities for both the genders, men and women. So, taking that cue from Swami Vivekananda ideals, I think Cepheid is progressing and following that kind of ideals, and I really acknowledge you and congratulate you personally as well. Last year, we celebrated 75 years of Indian independence, and our Honorable Prime Minister has described the next 25 years of our journey towards 100 year of Indian independence as Amrit Kal. Amrit means nectar. The CBNAT device manufacturing unit will also strengthen Honorable Prime Minister Shri Narendra Modi's vision of tuberculosis Mukt Bharat Abhiyan and making India TB free by 2025. We all know India is progressing quickly rather. That is why India is today the fifth largest economy and also the world's fastest growing economy. So it is truly an Amrit call for all sectors, and medical devices manufacturing is no exception. The global medical devices market is projected to grow from $495 billion in 2022 to $718 billion by 2029 at a CAGR of 5.5%. India is the fourth largest market of medical devices in Asia. The size of the Indian market is estimated to be around 12 billion US dollars, with the sector comprising large multinationals and small and mid-sized companies. In line with Honorable Prime Minister Shri Narendra Modi's vision of Atmanirbhar Bharat, has India has taken several steps to create a conducive ecosystem for medical devices manufacturing in India. See, we all know during COVID times how important these diagnostic tools were, the kits were. And similarly, in the growing economy, in the growing world today, the medical field is facing new challenges. Every day we are facing new challenges. We are seeing new infections, could be a contagious one or the non contagious one. Today, NCDs are on the rise, non contagious diseases are on the rise. And there are diseases specific to certain genetics, infections pertaining to certain genetic patterns. So, the research and development in this sector plays a very, very significant role. So, in that aspect, Danaher, the mother company, the mother organization, is doing its bit for the global need. And I really acknowledge that you have created this state of the art facility in Bangalore. The facility looks splendid, clean, and I should say that this is one of the best facilities that I have visited so far. So we all know, according to the Global TB Report 2022, TB incidence in the year in India 2021 is almost like 210 per every 1 lakh population. So the causes, we all know that. It could be because of poverty, it can be because of lack of awareness, it can be because of contamination, and it can be because of certain diseases. Immunocompromised patients, they are also vulnerable for tuberculosis and other infectious diseases. So this company, I think India's share in the global market is around 1.5%, and the sector is still at a nascent stage in the country. You have arrived in time. I think you arrived in time. During COVID times, fortunately or unfortunately, I was a health minister of Karnataka. When we had no PPE kits, when we had no masks, when we had no RT-PCR kits, we had to fight this pandemic. We had to fight this monster. So fortunately, after 1.5 years, we were judged as the best state to have combated the pandemic in the whole country. And we received a Health Giri Award. So during the COVID pandemic, the Indian medical devices, this sector contributes, which is quite visible, with the production of medical devices and diagnostic equipments such as ventilators, RT-PCR kits, thermometers, IR thermometers, PPE kits, and N95 masks. But local production is largely at the lower end of the technology value chain. So, this facility is not just going to cater to the needs of the country, it's going to export to many other countries as well. I was told it has a capacity of manufacturing close to 15 million tests per annum, which is huge. And I asked, as a normal Indian, I asked them, how affordable is your test? So they gave me a roughly about $9 a kit per person. So only my request as a health minister would be, in India it has to be a different price tag apart from whatever you give to other countries, because your setup is in Bangalore, and Indians, we have more number of patients who are suffering from tuberculosis. We have taken this as a mission mode. On a war footing, we are trying to eradicate the way that we eradicated polio in the past. The smallpox and the chickenpox, the way that we have eradicated these diseases in India, our Honorable Prime Minister has taken this as a challenge to eradicate the tuberculosis also by 2025. So the government will also lend a supporting hand to this organization. Let us, you know, partner, collaborate with the governments. I'll ask my principal secretary to also have a discussion with you, with your organization, in what way that we can do, and we can reach out to those needy people quickly. The order is that of healthcare delivery systems should be, it should be predictive, preventive, then the treatment. So that is the technology, that is the way the technology is evolving across the globe today. You can predict the diseases much before than the actual diagnosis time. So there is a room for you to predict things. Once you predict, you can always prevent the disease. Prevention is always better than cure. Always I say, when we are coming up with new facilities, new health hospitals, new facilities, it is not that we invite more diseases to come to our people and we treat. We have to prevent in the first phase. So that is the ideals that we believe in health ministry. So we will associate, will collaborate with Danaher and Cepheid. We will do, we will reach out to our people well in time. We will try to, screen those patients that require screening. That is why we have started new clinics, which is Nama clinics, about 438 in our Karnataka state, which will cater to the urban poor. Similarly, we are starting a new clinics called Ayushmati, which will be dedicated to screen only the women. Again, catering to the urban poor and the semi-urban poor. So this is the first of its kind. These clinics are being, established in the state. Overall, this state, our government is committed to give a global healthcare services, a standard global healthcare services to our people, because availability, accessibility, and affordability, these are the three mantras that we believe and we want to do it. Again, It's a great honor and a privilege to have come and inaugurated this great facility. I would like to congratulate and I would like to wish a very all the best from the health department as well as from government of Karnataka. So we will support you in future as well. Anything that you require from the government, we will be there for this facility. So thank you. Initially, initially I was in two minds because we are in the midst of elections. Elections is just around the corner. In about 45 days, we are going for elections. So I was prepared to go for some election campaigns. I was in two minds whether I should come or I should go straight. But if I had missed this, I would have missed something really important. So thank you. Thank you once again. I should thank my personal assistant. He was very, very adamant. He was saying, sir, we should visit this facility. So I should thank him also. Thank you very much.